The program in public health has a number of courses to it. I am focusing on one of those, and this is environmental public health, the environment around us. And you know, some people, when they think about environment, they think about, you know, toxic and hazardous materials in the environment, in the water, in the air quality, in the food, and so forth. And my program is that, but it is actually more than that in addition. We also talk a lot about the physical, the chemical, the biological features of the environment, including that influence human health. So that would include built environment. And so some people don't even know for sure what the built environment is, but it would include the roads and the streets, the community design and so forth, and its impact on health, including not only physical but mental, emotional health on the people who live in this environment. So hopefully this course will keep on the leading edge of science, and on the leading edge of what's going on in this country and trying to improve health from a public health standpoint. Yes, you know, people are thinking green, meaning, you know, watching on water pollution and air pollution and so forth, trying to prevent that from happening. And that is an important part of it, because in the course, for example, we'll be talking about manufacturing and energy production and agriculture. And all of these things are really important and valuable to our society. But each one of these important economic drivers also have environmental consequences. They can influence the air quality and the water quality, agriculture included. So when we talk about these things in the course, we'll be talking about what I call the triple bottom line. So it's not just health of the people, which is important, but we also need to be concerned about economy and the environment. So the triple bottom line is human health, the environment, and economic development.
Now, how about all these courses are online?
Yeah.
And so how does that work out? You know, you don't really see the student; they don't see you. So how does that work?
Yeah, that actually, you know, how it works. Here's what I do. I produce a video each time for the beginning, the introduction of each course, each class. And that video is fairly brief. It introduces the gist of the subject. Then the students have access to lecture materials. These are original lecture materials produced by me. And these lecture materials will not only have words describing the content, the gist of the readings, but it'll also have links to video. It'll have links to other published materials, you know, a whole variety of things. So in a way, I have two thoughts. In a way, there is not as much face-to-face as I personally like to have. But we're moving, it's a new world. People can't get out of their jobs to take courses anymore. People don't live in East Lansing. So that's one thing. But the students will have access to all of the technology that's available through the Angel system that we have here, and honestly, it will grow and it will be greater than what's available in the classroom now and in the future. What they're going to do with their lives and their careers, I'd say welcome to environmental public health. This is my course actually happens to be one of the required courses. You know, if we look at the just give me just a notion about why this one might be required. If we look at the longevity of people in the United States, how long people live, you find that there has been an increase of about 30 years over the last 100 years, okay? People, lifespan. The great majority of that, all but maybe a handful of years, is due to public health. And most of that, and this is me making a pitch for environmental public health, but most of that is due to changes in the environment. Living conditions, water quality, air quality. So I'd say welcome to environmental public health. It's been important in the history, health history of this country, and it will continue to be important for a long time. You know, here's one of the things that I've noticed in my classes and who's taking the classes. I would say roughly a third, you know, I could be off a little bit on these, are medical doctors, MDs, and doctors of osteopathic medicine, and doctors of veterinary medicine. And then another third, I would say roughly, are professionals in environmental public health who are on the job. So they already have full-time jobs, and they're not, they don't have time to take off, they have families. And I would say the remaining third are probably students who are moving right from their undergraduate programs into the Masters of Public Health programs, you know, directly. So a third, and third. So it's really kind of an interesting mix in the classroom, you know, to be honest. People say, how could the new people compete with the people who are professionals in the field, you know? But there's always fresh eyes, and I think that that's really important. So the conversations that we have in the discussion forums, you'll see different perspectives. The students will, and I think even with the new ones, the fresh perspective on some material that's been around for a while will add a lot to the student experience. Some of them have said things like it has opened their eyes regarding public health. And I think one of the reasons that they came in thinking, you know, pollutants and contamination and that kind of thing. I think environment, you know, that aspect. But to think about, for example, the built environment, the way we design our communities and so forth, with the way our neighborhoods are designed, with not only for walkability and driving, but also for social capital, you know, the way the communities are designed to help people interact in positive ways. It's part of environmental health. And there's a growing body of data to show that that actually can make a difference. And so that is part of the course, and so it has expanded expectations of the students, and they're enjoying that.